My name's Yerondais. I'm the CEO with Myotherapy Association Australia. We're the peak industry association that represent qualified myotherapists nationally and been operating for 30 plus years. You may have known of us as IRMA, so Institute of Registered Myotherapists Australia, prior to a rebrand and a name change. Just made more sense to be the Myotherapy Association Australia. It's what we do and it's what we know. So basically the way it works for us is that we recognise qualified myotherapists as members, but we also have I suppose like an interim membership period for those that may be studying remedial massage and wanting to undertake a pathways through to a myotherapy program, whether it's the advanced diploma or the degree program, which I understand there's a very positive relationship with Torrens University for the pathways into their degree program. And essentially, if people join with us under the interim or remedial massage level, they must either demonstrate that they're enrolled in a myotherapy program, or we provide them what's called a grace period. So we essentially say, look, there's 12 months. We understand some people may want to go out and practice. It may be a financial means. It may be about establishing, some networking connections or patient base. But within that 12 months, then you need to then demonstrate that you are going to be enrolling in a myotherapy program. The reason we do that is quite simply, there's a number of associations that will represent remedial massage therapists, and they do it very well. So we're not overly interested in being in a competitive space. Our goal is to continue to represent and raise the profile for myotherapy. We've been doing that very successfully, and in particular throughout COVID. I think the association's been quite instrumental with regards to conversations with government throughout these periods. So that's who we are, and I'm really happy to take. I can probably speak more confidently with myotherapy, but I'm happy to sort of touch on remedial massage as well. I'm a graduate of myotherapy program. So I actually graduated, I finished in '99 from the only myotherapy program at the time, and that was at RMIT. So what I personally, if I sort of take off my association hat and come back to when I was a practitioner, is that I've definitely seen a much broader and deeper understanding from a consumer-centric perspective about myotherapy. I can guarantee you, when I graduated, there were very few people when they said, "What do you do?" and I said myotherapy, they often, smiled kindly, but you could tell that it was blank. So then you'd have to go through the discussion about what it is. But we're not faced with that so much, particularly here in Victoria. It's very strong in Victoria. So the future for myotherapy, we really want to see myotherapy's national footprint. So we want to start seeing more and more training providers outside of Victoria, bringing the program onto scope and delivering it successfully. So that's definitely part of our strategic profile and the plan that we have. And I think, whilst COVID has presented a lot of real challenges, and here in Victoria, we're probably being faced with some of the greatest challenges. We're in our 6th lockdown at the moment, and myotherapist somehow disappoint the government, and we're trying to determine what happened and why. But they seem to have moved the goalposts with regards to essential healthcare. We advocated very strongly and very successfully at the start of COVID, where back in March it first happened, we were told no. Within 12 hours, we had much of that overturned. So yes, you can provide essential clinical care, and slowly it opened up in all the states. We've maintained those conversations. For some reason here in Victoria, they've chosen to default to an allied health list, which in itself is fraught with a number of issues, because allied health is a very confused definition. It's not the same across all jurisdictions throughout Australia. So whilst we have one list here in Victoria, there'll be a list in New South Wales that will differ, because they consider allied health only for those who can operate in the public health system, and the same applies to Queensland. So we know that allied health is not a good default. We know that we were permitted to work certainly throughout many stages of lockdown last year and some earlier this year. So we're now advocating very strongly to government that myotherapy is an essential healthcare. We work alongside allied health, medical, all of these other practitioners. We certainly know how to practice in a COVID-safe environment. So what we are seeing is more and more people, we're seeing myotherapy now referred to on the Department of Health website. So whilst we're not a listed allied health, we're seeing a reference to myotherapy on that website. So we're starting to see recognition for myotherapy as that health service provider, part of the health scope or sphere within this nation more and more. So we're very excited about that. And we're really keen to just raise the profile. We understand that whilst I said Victoria, we're quite well known, I think, but we also understand outside of Victoria, perhaps the profile for myotherapy needs to be raised. People need to understand what it is. They need to understand the benefits of myotherapy. They need to understand the qualification for myotherapists. So that is where we see the future, is that we'll continue to grow myotherapy. We'll start to see more and more providers who are delivering myotherapy programs. A great example is we recently saw that there was a proposal for a new advanced diploma of remedial massage program. Now, industry overwhelmingly said, we don't understand it and we don't understand the need for it. And I think particularly when we have a very good advanced diploma program, and that being the advanced diploma of myotherapy. So I think that's a real great example of the fact that there's a wonderful program there. And yes, we also have a degree. And the exciting thing is that we have a pathways option into this higher education level with the Bachelor of Health Science. So I don't see myotherapy going backwards by any means. I think if we can demonstrate anything from what we've seen this year, it's continuing to go up. It's a really exciting health career pathway. So we definitely, and sorry, I didn't touch much on Remedial. I will quickly say Remedial Massage. So it's recently, the program's gone under a product review or program review. Yeah. And I'm not sure if you had a chance to have a look at what those changes or reviews look like, but I think they're really exciting because what they're doing is they're bringing it into alignment with what we're seeing patients presenting with. So, they're raising the standards of all of these programs, which is only for the betterment of the profession as a whole. So from that perspective, with Remedial, I think that's great and it's very exciting, and it's providing a very nice foundation for any of those students who then do choose to take the pathways option into a myotherapy program. With regards to the payment option, again, it's a landscape I think that's changing. We're starting to see more and more people who are becoming employees of businesses as opposed to sort of the subcontracting arrangement that we've often seen. That really comes down to, I think, more businesses becoming more aware and understanding employment law, or at least being advised appropriately. So there is the Health Services Award, which is essentially what remedial massage or myotherapist would fall under. And I'm happy to send you the link to that, Justin, after this, and you can share that with your students. It gives you a nice guide with regards to, an employment pay structure. Typically, I think you'd see that many remedial, I think, varies perhaps a little bit more than what we see myotherapy with regards to an income scale or revenue scale for them. However, myotherapy, consistently we see people coming in for an initial consultation where the billing is anywhere between, say, $100 to $140. So depending on the arrangement they have. So if they're a sole trader and they're just renting some space, for example, you apply all your business knowledge, understand what your outgoings are, and it comes down to that. Typically, we would say that, what you'd probably look at is a part-time. So part-time is probably somewhere around about the 26 hours a week. There's certainly opportunity for practitioners out there to be in an earning capacity of anything between 45 to 65,000 per annum on the part-time. again, it really comes down to how they structure their business as well. Is an initial consultation an hour? Is an initial consultation 45 minutes? Or as an example, at the end of the time of me practicing, so, you know, I'd been out for 20 years, my initial consultations for patients, I allocated 40 minutes. It didn't mean I always used it. I allocated 40 minutes. My billing was 125, and any return consultations, I allocated 25 minutes, and my billing for that was $95. So that just sort of gives you an example of some of the pay structures. It really comes down to how people structure it, and then also I think experience, you know, in the trade.
Yeah. Excellent. Thank you very much. Thank you, Justin, for the invite, and welcome everybody. It would have been nice for you to see me and me to see you, but we'll do our best. So Ed is sharing the slides, and so you can see there how specifically I'm going to talk about the Bachelor of Health Sciences in Clinical Myo, and specifically this is a round diploma of Remedial Massage and Advanced Diploma Myo upgrade pathway. So if you could manoeuvre forward to slide 2 and then 3 for me, please, Ed. And so you will see on slide 3, one of the emphasis of the clinical myotherapy program largely relies on pain management. And so one thing that we particularly focus on in clinical myotherapy is a pain management framework. So one of the things we particularly like to do is allow students to go through a journey on pain management and managing patients. So using treatment and rehab specifically targeted to musculoskeletal pain, we tend to find that this is a real key feature of our clinical myotherapy program, and so we wanted to emphasise that. On slide 4, as Ed changes to that, you will see that we are particularly focused on this middle point here of providing access to treatment, promoting physical activity and education. And the idea again is using the pain management framework, or treating the whole person using a biopsychosocial framework, is a real key. So down the bottom, we very much want to support myotherapy, clinical myotherapists to really better understand musculoskeletal health. So it's not just specifically targeted to muscular system or neuromuscular system. It's much bigger than that, because we realise that we really are dealing with people. So soon you'll see a couple of slides that Ed has that will take you through the course curriculum, and you'll see particularly a lot of the subjects are around treating the whole person. So again, that's a real key. If we move to slide 5, the benefit of upgrading to the Bachelor at Torrens University, we see, you know, breaking it down into Think, health education, we really see the benefit being a multi-campus across Australia, so Torrens University and Think having a national footprint. We really see that also as a benefit. And the other benefit we see as well, particularly here, is the idea for interdisciplinary practice. And for example, I teach into the myotherapy program, so of course you'll see something about me in a moment and my colleagues, but we teach a range of disciplines. So for example, you might be sitting next to students who, for example, in evidence-based practice are nursing students or Chinese medicine students. And so that's another real key. You know, the fact that it's Torrens University and Think have a national footprint, and we like to think we're growing that, but also too, we really enable the idea of having close relationships with other networks, and I think that's a real key too. So specifically, I guess, as well, another strength we feel we have that we can offer as part of the myotherapy program is the idea that we've been doing this for some time. And so under the banner of Southern School and Torrens, etc., again, largely you can see there the different disciplines, but specifically with myotherapy, you will see you have an opportunity to work with educators like myself, and you'll see my colleagues in a moment, where we teach across a variety of things, and that can be really cool as well. One of the other key things to probably note of interest down the bottom right on slide 6 here is you'll see that we are based in Melbourne for the clinical myotherapy program. But again, as I was explaining, we do have a national footprint. So you're able, for example, to be online with students from other states, and they might be enrolled in a different degree, and you get to, cross-collaborate in that way, and that's really valuable. So just moving, Ed, please, to slide 7. You will see the academic team. So currently you're listening to me, Michael, and so I'm a senior lecturer, and I've got a range of tertiary qualifications, which puts me in good shape, I think, to teach and to facilitate your career. And then also too, we've got a real main player in myotherapy for some time now, and that's Andrea in the middle of the screen there. And she has a nursing background as well as a myo and pain management background. So again, note that focus on pain management and treating the whole person rather than focusing specifically on only one system. And then Tim Travail on our left-hand side, I'm speaking for him today. So Tim, as you'll see there, is our program director. And Tim and myself are currently completing PhDs. And again, we try and practice what we preach. For example, Tim is currently working as a myotherapist in Melbourne, and currently on the right-hand side, I'm an osteopath. Previously, I was a myotherapist about 15 years ago, and I currently practice too. So we try to stay up to date, and we really try and have that connection, with myotherapy and the connection with allied health. So I think that's important to recognise as well. So just moving on, so just how will you study? So again, you're coming in, perhaps you're interested in this upgrade idea. What will you be doing? So particularly at the moment, we're focusing on the idea of being very flexible online. And so, for example, I've mentioned pain management as subjects. So with pain management as subjects, you'd be studying pain management fully online. And that's flexible. And we like to think it's flexible because we largely try and provide an opportunity for multiple contact points. You might then do a particular subject, such as a dry needling, which would be scheduled face-to-face. You might also have what we call flip, where you would do some online learning and then perhaps go in for some intensive work. That might be practical work or something like that. And so on the previous screen, you saw Tim, Andrea and myself, but of course we have a whole heap of sessionals who are myotherapists or physiotherapists, osteopaths, who would be teaching you through some of the practicals as well as some of the online content. So our subjects are, as you'll see shortly with the course map, they are sort of sequential, but then there's a fair bit of flexibility into basically how you go about it. So if you are planning on continuing being a family member, looking after other family members, or you're working, you can kind of manipulate your degree to fit around that to a certain extent. So I'm now moving on to slide 9, and largely here I just wanted to point towards the fact that Torrens as an institution will typically support you by allowing you to do some science success course training and providing academic support. And one of the other real keys we like to think is because you are on that journey and you are upgrading, we really want you to focus with success coaches to really work out what it is that you want to do in your career and how best we can assist you in completing your degree. So I think that's certainly worth mentioning. And just Ed, as I move on to slide 10, I think this particular slide will be of interest to many. You'll see here we've got, for example, if you've completed in the middle a diploma of remedial massage, this is a written sort of block credit where we go, okay, well, if you've done the diploma of remedial massage, will we give you 12 subject exemptions? There's a couple of conditions on that, which I will highlight on the next slide. But largely you can go, wow, that gives me 2 years of study credits. And therefore 1 year of study credits, and therefore I've got 2 years of study remaining. But if you've done the advanced diploma, you get 2 years of study credit, you've only got 1 year remaining. So I think that's important. And just as I manoeuvre to the next slide, there's a couple of little things to just note. So when you're sitting there reflecting, block credit will certainly only be granted where the work from the previous slide, so your diploma, advanced diploma certificate, has been completed within the last 10 years. Okay, so that's important to recognise. So for example, if you've done a certificate 4 9 years ago, not a problem, clearly. But then again, if you're partway through your advanced diploma thinking you might switch now because a while ago you did a Cert 4, something like that, just note some of these conditions. The other point I'd just like to make here is block credit granted must still leave the student the equivalent of at least 1 year of full-time study. So just moving back, if you wouldn't mind for a second, Ed, to slide 10. For example, if you are a student who has done a Bachelor of Nursing and you've also done a Diploma of Remedial Massage, we can do our best to try and provide you block credit. But then, as the condition stated on the slide just before, so now moving to slide 11, please, Ed, you'll see that the 4th bullet point here says you need at least 12 months of full-time study remaining. Okay. So just manoeuvring to slide 12, you will see a nice map. Hopefully it's viewable and okay on your screen. On my screen, a few things to note is we're obviously running the natural course of the program on this slide, so Year 1, Year 2, Year 3, 3 trimesters, so 36 weeks of study per year, each trimester being 12 weeks. You'll note there, like most health sciences degrees, and health sciences degrees with a clinical focus, so myotherapy, we're going to give you a fair bit of background pathological, physiological knowledge in the first year, and then in the second year continue on. The third year, really, the overview of the third year is it's, of course, more advanced, but it's a focus on getting into clinic and actually doing. So that doesn't mean you do 2 years of theory only in the first 2 years, but you're certainly not then yet exposed to treating in our practice clinics and, working with clinical supervisors and those things. So on the bottom right of the slide, you'll see the red and the white, and that's to highlight the fact we do have a year-long clinical component because, of course, as a clinical myotherapist, we want you in clinic. We want you getting that real experience of what it's like to be a myotherapist. So definitely these subjects as well, I'd also like to recommend or remind you that a lot of these subjects as well will either be fully online or flexible online, we call it, or they might be face-to-face. So for example, the dark red, you can expect a year-long face-to-face in the clinic. Pain management, online. Surface anatomy though, face-to-face in practice where we can. Neuromuscular techniques, exercise prescription. So I think it is really important to just consider that and consider what you've done previously and consider, okay, well, I've done the advanced diploma. Okay, that leaves me this amount of study, but what do those subjects look like? How can I, live my life and continue my professional life around the degree? So then just on the next slide, again, you'll see on the left-hand side, it says, well, okay, I'm a grad of the advanced diploma. What that means is you typically complete the one that are coloured in that apricot sort of light brown, orangey colour. So they're typically the subjects we need you to complete. So again, that's important to recognise. So just an overview, if I can, Ed, on slide 14. Because we are treating the whole person or trying to work with the person and doing, whole person management for health, you can see here how we give tick boxes next to these things because, again, we're really trying to extend you and get you more as a healthcare provider and advance that understanding. And we feel that that's very important, again, using that biopsychosocial framework. So that's why we've got ticks next to those. Slide 16, please, Ed. And then look here. If you haven't thought about it, or perhaps you have thought about it, hence you're here and you want to know more, but some very specific points just as to why you might upgrade from our point of view. And again, we tend to feel that we have a big focus on pain management and treating the body as a whole, as I keep saying, and so that should shine through if you were to take on the clinical myo program. And the other thing particularly I'd like to highlight is we have a real focus on creating a structure and a plan for the patient. So whether that be rehabilitation or whether that be manual physical therapies, tri-needling, we help you tailor that to the patient. And that, I think, is a key as well. So just moving to slide 17, we also feel that when we're treating the patient as a whole, I'm sure you're all very aware of evidence-based practice and needing to speak that language and perform techniques and management strategies with the patient, again, as the centre. And so for me, that's a very important thing to recognise here. Okay, we have a focus on that. So I think there's one more particular slide I'd like to cover, if I may. Well, actually two slides, slide 18 and slide 19. So I particularly want to focus on the idea that we want you getting work ready. So we want you to get into our clinical practice clinic. We want you treating real patients in that third year with clinical supervisors. And so at our student clinics, we very much value treating the community, and we feel we do that very well and give a very good experience through there. And we've recently developed the Fitzroy Clinic, so that Melbourne clinic, and it's looking pretty smick. So then the last slide I might just talk through, if that's okay, and then Ed, you can share the slides perhaps to Justin and Justin onwards. But lastly, I just wanted to talk about the last year, and again, that focus on getting out and getting you ready is we very much have, as you can see here, 200 hours of supervised clinical practice, and I think that that's a real key. Being able to get in, and as you can see here, this is a sessional of ours, Neil, getting in and working with myself, Neil, Andrea, Tim, and others, and learning those skills and doing it one-on-one. So I think that's another real key.
Well, students might be very interested into this migration side, because we have a lot of international students here studying with therapy and also with Torrens. So probably we can invite Simon to just give us a brief on what are the possibilities if you are students in this myotherapy, massage sort of sectors. What are your possibilities of doing? And also, more importantly, about the postgraduate study visa, about the 485. A lot of students are asking if I finished a diploma or even advanced diploma with Max, and if I only study 1 year with Torrens, I must still be eligible for the 485 visa. So Simon, can you just explain a little bit about this? Yeah.
Okay, great. So this is our website. So in our website, there is a very useful tool. Then you can search any nominative occupation on this website, and they will jump up that whole picture about the possibilities and opportunities for your nominative occupation, which pathway can go to get a PR in the end. Okay, so start with this. I want to talk about the 45 visa first. So the reason why the 45 visa is very important because it gives us the 2 years, maybe 5 years for Hong Kong visa holder, but normally 2 years working visa for the applicants onshore to accumulate their working experience, to have more points, to satisfy the state nomination requirements. So regarding to today's topic, the diploma and advanced diploma courses combined with the bachelor courses, it is possible to apply for the 45 visa if you satisfy all other requirements. The course package itself has already satisfied the Australia study requirement, which is very important requirement set up by the Department of Home Affairs. And also besides the Australia study requirements, you also have to satisfy all other requirements. For example, you have to get the IELTS or 6 or equivalent English result. You also need to get OBHC. You also need to have a health requirement. And yeah, that's all. Because the Australia study requirement is the important part of the 45 visa, and because you have already you have already completed a bachelor courses, and a bachelor courses combined with diploma or advanced diploma courses, the course package itself has already satisfied the Australian study requirement. So the 45 visa is good. Then we come back to the website. Then you can search what kind of state nomination program you can go. The massage therapist is not on the long-term list, so we can only focus on the subclass 190 visa and subclass 491 visa. So both of these visas are state nomination program. The difference is subclass 190 is a permanent residency visa right away directly. And the 491 visa is a 2-steps visa. You have to apply 491 visa first, and then after 3 years, when you satisfy all other requirements, then you can get the permanent resident visa in the end. Okay, but you can see the state government just have a higher standard for the subclass 190 visa. They don't usually give the candidates subclass 190 visa directly, and they just give them 491 visa, but the requirements for the 491 visa is quite easier than the 190 visa. Okay. Then I wanted to talk about 2 possibilities. I think it is very useful for the candidates who want to apply the PR. The first one is Victoria government. The second one is Tasmania government. Okay, the Victoria government, because in the new fiscal year, the Victoria government just changed their policy, and the state government requires the applicants must be currently working in one of the Victorians' target sector using their STEMM skills and qualifications. So I would say the massage therapist is in the STEMM skill and the qualifications because it related to the health. But however, you still need to find out an employment in the target sector. So what is a target sector? Then you can this is a Victoria government website. Then you can in this website you can search for target sector. They jump out 7 different categories, 7 different industries. So for example, if you are a massage therapist, you get your nominative occupation. Then you can work in like a hospital, you can work in an aged care facility. Then you can say you are working in the target sector. Then you can apply a subclass 190 visa state nomination program or 491 visa state nomination program to the state government directly. Okay, so there will be quite easy way for you to get a PR by using a state nomination program. Okay, but there are so many industry and categories, so you might want to search it. And if you have any individual questions, we are happy to solve it in Q&A section. And the second option I want to talk about is about Tasmania. Okay, in the Tasmania, the reason why I mentioned about Tasmania because you might usually find Tasmania is more easier for the people to get a 491 or 190 visa because they have enough allocations places set up by the Department of Home Affairs. And if you wanted to apply the state nomination program in the Tasmania, if you want to apply for the 190 visa, you have to study there for 2 calendar years. And if you wanted to apply for 491 visa, you only need to study for 1 year. However, there also have a working stream, which means if you are, like for example, a massage therapist and you have employment in Tasmania and you have been working for the employer for 6 months as a massage therapist, then you can get an invitation directly. You don't have to study there. Okay, but so there are different stream, means different requirements, means different opportunity. Okay. So I think this is all up about the permanent residency pathway for the massage therapist candidates. Okay, regarding to other non-medical occupation, for example, the physiotherapist, I guess if you wanted to study further courses, like for example the Bachelor of Physiotherapist, then you might get the skill assessment, because the skill assessment is very important for applying the permanent residency, skill permanent residency. You have to study accredited courses first, then get the skill assessment for APC, which is assessing authority for the physiotherapist. Then you can get the skill assessment. When you get the skill assessment, then we can talk about, we just start this process again to search out which state can nominate the physiotherapist. Then you can find out your opportunities and the possibilities in the future. Okay, yeah.
As a student, when you finish either the massage course or the myotherapy course, the first thing you have to do is to think about how you can get skill assessment, because that's the key to PR, is it?
Yeah. The skill assessment for the massage therapist is VITASIS, the assessing authority. Then the VITASIS usually requires people to have 1 year's working experience post qualification. So you have to find out your job first once you complete the courses.
So as I remember, it was 20 hours per week, is it?
Yeah, 20 hours per week minimum.
Yeah, so students, please pay attention. If you're thinking of get your skill assessment down, make sure your 1 year full-time after graduate, or not full-time, more than 20 hours work experience is fully recorded, because that's the key for you to get the skill assessment done. Thank you, Simon.
Yes, thank you, Justin. I will do it go through it very quickly.
Sorry.
Yeah, this is a Melbourne campus. If you finish diploma or the advanced diploma with Max, you can have the credit transfer and study with our Melbourne campus. It's 5-level buildings, fully renovated education provider, and it's connected with the landmark in the Melbourne CBD. And this is one of the biggest building of Torrens in Australia. Yeah. So the other thing I want to focus is that we have 3 main intake in a year. That's in February, May, and September. That means students can finish their current study and join our bachelor degree study. Yeah, quite flexible. And I also want to share this scholarship for you. At least the student can get 15% scholarship, and at most as 30%. So it's case by case, but I will try to apply best for you. Yes, that's pretty much the key things I want to highlight here. So for any more information, maybe you can just go to Justin for those information, and I will share this virtual online open day information with you through Max. So for any application or information, you can just feel free to contact Justin or me. Yeah, thanks for this.
So Eva asked, if it's on 45 visa, I think that's a common question. Working requirement for skill assessment, is it still 20 hours?
No, there's no any skill assessment requirements for you to apply a 2 years 45 visa, because your study is a course package. When you finish your bachelor courses, you are being assessed by PSW stream, not the general worker stream. So in the PSW stream, you don't need to get a provisional skill assessment. You just directly apply for the 45 visa. For your circumstances, like for example, if you only study a 2 years diploma, then you apply for a 45 visa. You can only apply for a graduate worker stream, which is 18 months working visa. Then in that particular circumstances, you need the provisional skill assessment.
Yeah, so in our case, it's straight away 2 years 45.
Yeah.
Does application for a package with diploma and degree program have to be submitted by AMET? So that's my question. So it doesn't really have to submit by us. It can go direct via your agent, or you can contact Torrens direct. But we're always there. I mean, normally it's easier for you to come to us. Either come to me or come to Lin, and normally I'll handle this, and we'll help you out with this process. Will Torrens issue a conditional offer letter or COE in order to apply for 4 or 5 years visa? I think that's an ad question. So conditional COE, yes, it is, right?
Yes, it's package COE. Yes, once you apply through Max, you will get package.
Yeah. What is the deposit for Torrens, Ed?
It's normally it's 1 unit deposit to get the Torrens COE. Yeah, if you apply through this package.
Yeah, so that's around how much? 2,900, is it?
Yeah, around it, 2,900, you will get Torrens COE.
Well, is the 15% on that as well, or is the 15% comes later?
15% will apply when you get offer. So you may pay less than that. Yeah.
So for example, the deposit is let's say 3,000 for 1 unit, and also you can apply this 15 on this 3,000 as well.
Yes. Yeah, you just deducted that scholarship. You pay for it.
Yeah, right.
I think as a student, joining is a bit of a no-brainer from our perspective, because it doesn't cost you anything, first of all, and it grants you access to everything to understand about the association. So our student members, they receive all the communication that goes out from the association, which has been quite a lot recently surrounding COVID restrictions and what we've been doing, and also just updating members about what that looks like for their practice. Also providing that information to training providers so that they know what it looks like for students. It also provides you an opportunity to network with fellow myotherapists. We've heard in this the importance of gaining clinical experience and clinical hours. So, establishing a network within your profession is really important. Students are offered, special student discounts for a number of our events. So whether it be online events such as our upcoming conference or our in-person events where it's appropriate for students to participate. And also it gives them access to support. So if they've got questions about, look, I'm about to graduate and I just want to understand a bit more about what I do with regards to provider numbers, what do I need to consider around insurance and all those other things, our team can answer those questions for them. I guess, the question about why join one association over another, it's going to come down to personal choice with regards to what career pathway the students are looking for. I'd say if you're studying myotherapy, to me, and it's biased obviously, but it makes complete sense to be with the association that represents that profession. So Myotherapy Association, we are the only association that will solely represent myotherapists, and we respect and we work closely with the other associations, but we also understand that their membership base does need to be quite broad. Their representation does need to cover remedial massage or myotherapy or ingestive therapies, whatever's part of their association. So we will solely represent myotherapists, and they're the conversations we have when we're in there. But as I said, student membership, it doesn't cost you anything. So once you graduate, if your choice is to be whichever association, then you go with that. But if you're a member with a number of them as a student, it gives you an opportunity to understand how each association communicate with their members, what they provide their members, how they support their members, because that's what you need to understand when you're a graduate. What sort of support are you getting?